This year, more than 140,000 Americans will be diagnosed with cancer of the colon or rectum. More than 50,000 people will die from the disease. Doctors have seen an alarming jump in the number of cases in people under the age of 50. So joining me now to talk about this is Dr. Zuri A Murrell, a colorectal surgeon at Cedars-Sinai, and 44-year-old Gina Pavey, who was diagnosed with the disease last year. Gina, let's start with you because you went in for a screening and you just thought you were being good about it.
I did. I was 42 when I was diagnosed. It was my first colonoscopy. I requested it because of a family history, and I thought I was being proactive. I thought I'd get my pat on the back, and I guess I still get a pat on the back, but had a different outcome that I had hoped for.
And the outcome was?
Colon cancer.
Yes, and it was, you were already in the stages of cancer at that point. All right, and you had surgery, and what happened?
Yes. Dr. Murrell removed the tumor and part of the colon, and then he also took some of my lymph nodes and tested those, and they were all negative, so basically that was it.
Dr. Murrell, how far along was she at that point?
Well, luckily, she was very proactive. Even though that colon and rectal cancer is the #2 cause of cancer-related death in America, the key is that if it's caught early, you can still cure people with surgery. And she was very proactive because she had a family history. Even though she was young when she got her colonoscopy, her father had colon cancer at age 50. So she knew to get her colonoscopy at age 40.
Gina, how'd your dad do?
He passed away.
He died from colon cancer?
He actually died from the surgery. They made a mistake during surgery. So surgery was even a tough sell for me.
That had to be a tough sell. Now, did you feel sick? Did anything feel bad? No. Even after you found out, did you feel anything?
No, Liz, that's one of the things that surprised me so much. Even in fact, the day of surgery, I said, "Are you sure?"
Yeah, you didn't want to
never felt
it.
better.
Yeah.
Never felt better in my life.
All right, Dr. Murrell, let's go back to you. And there are 5 things, I guess sort of 5 myths that people should know about colon cancer. We've heard some things about it, but...
Right. So there's common myths, which even surprised me to this day, is that a lot of people don't know that women can get colon cancer.
Right, we think of it as men, right? I mean, one of the most famous stories is Katie Couric's husband died from colon cancer, and I think that sort of set the pace there.
Yes.
So women can get it, and they can get it at a young age.
Exactly, and they get it about the same rate. Like I said, it's the #2 most common cause of cancer-related deaths for men and women.
You said it can be prevented if we go in and we get the test done.
Yes, you
so
get a
it's
colonoscopy.
Preventable.
Yes.
Okay, one of the myths is that African Americans are not at risk.
Right. Now, African Americans actually, the screening guidelines, if you have no symptoms and no family history, are 50, except for African Americans, you start at age 45 getting a colonoscopy.
Younger.
And this is because African Americans tend to get colon cancer earlier and a more aggressive stage. And so it's very important, that you get the screening. Even though all of this sounds really like gloom and doom, the good thing is that this is the one cancer that can be prevented with a test, and the test is colonoscopy. The key with colonoscopy is that everybody thinks you're supposed to get it to find out if you have cancer. You get a colonoscopy to prevent cancer. It's the only test where you go in, you see a polyp which will become cancer, and you remove it at that stage before it progresses. And so in some ways this is actually, it's a very preventable.
Okay, so a colonoscopy,
yes.
It sounds so horrible. I mean, they're sticking a tube up your you-know-what.
Yes.
That's not fun to talk about, doctor.
It's not. And actually, I'm convinced that if there wasn't the word rectum, people would be more open to it. It's something about the word rectum, colon and rectum.
Yeah.
My father, to this day, gets mad at me when I talk about this at the dinner table. But I tell everyone, it is important to talk to your family about, because it saves lives. So the worst part about a colonoscopy used to be the bowel prep. But we have a new prep now.
Yeah,
where you
brought it.
It's basically Gatorade and Miralax. We do this at Cedars-Sinai. Gatorade, Miralax, and some milk and magnesia. This is the best tasting prep. And you basically drink this in clear liquids the day before. And it has the desired effect, which will clean you out. And then
clean you out. I just like to clean myself out with that stuff. Hey, our producer, Chris, who you all know, we talk about. Chris went through this. How you feeling there, Chris? Did you have that? He says he's fine, thanks. And he went through it just yesterday, so he's doing really well. Was I not supposed to bring that up, Chris? Well, too late now. Yeah. So, okay, so what else should we know? We just have to mention it to our doctors and we can get this done?
So, #1 is if you're around the age of 50, then you should have this done.
Definitely.
Okay? Now, if you have a family history, you should have it done
Gina.
like Gina does. You should have it done 10 years earlier. And like Chris has, you should have it done 10 years earlier than when the person in your family was diagnosed.
10 years earlier.
Also, if you're young, okay, and by young, I mean under the age of 50, if you have any symptoms such as rectal bleeding, change in your bowel habits, you cannot just attribute it to hemorrhoids. You make sure that, I tell all my patients, you're your own best advocate. And if you're having these symptoms and you go in, you should make sure that you're appropriately taken care of. And the best way to evaluate this is a colonoscopy.
All right, you guys, I thank you very much, Doctor. And Gina, thanks for sharing your story with us. We appreciate it. It's good to see that you're doing really well.
And the key, good attitude. Gina had the most positive attitude of any patient I've had.
Right, Doctor? It's always the attitude, even if you have to use the word rectum. All right, next, today in photo.